Health Today is brought to you by Caribbean Alliance Insurance, agent represented by BGI Insurance Limited.
In this edition of Health Today, we share how one organization is helping Barbadians to take charge of diabetes.
Do you know whether you really are diabetic? Are you pre-diabetic? Did you know that if you're pre-diabetic and you lived a healthy lifestyle and made the right choices, you may never develop diabetes? So you don't necessarily have to be a statistic, you know? And do you also know that if you're diabetic and you develop a foot problem, you do not have to lose your foot? If you are diabetic and you develop an eye problem, you do not have to be blind. You do not have to end up on dialysis.
Virtually every Barbadian knows someone suffering from diabetes. It's a disease that affects more than 25,000 people, costing the government millions to provide care and treatment. Chairman of the Barbados Diabetes Foundation, Dr. Oscar Jordan, cautions the island is facing nothing short of a crisis, and the effects are far-reaching.
The diabetes population keeps rising all the time. That's bad enough in itself, but the thing is that diabetes is not a solitary disease. It is a gateway to a number of other diseases, and its complications include heart disease, stroke, kidney disease, damage to the nerves, and perhaps the most feared of all, foot disease. And of course blindness, which I forgot to mention. So it's a major, major problem.
The worrying problem has not escaped the attention of specialists at the Warrens-based Maria Holder Diabetes Center. In fact, they are leading a radical intervention which is changing the face of treatment. Simon McConney, a podiatrist at the center and chief operating officer of the Barbados Diabetes Foundation, explains the medical professional is no longer at the center of health care. Rather, the patient takes charge and manages the disease.
The patient is what's more important. And what we've found so far is we have had really good result coming out of that. And as a result of that, we can also treat things faster, more efficiently, more effectively, and we can also take on new dimensions and we can trial things as well. So the Diabetes Center really is just the beginning of, I think, changing the landscape of diabetes across our region.
The center, the only multidisciplinary facility in the region, has a full-time team comprising a doctor, a diabetes specialist, nurses, a podiatrist, a nutritionist, and an education officer. Patients are treated by each member of the team, and they can also benefit from a support group.
A patient presents to the doctor. The patient, during the examination of the patient, the doctor may realize that the patient has a very suspect-looking thing on their foot. The doctor will either excuse themselves from the patient or pick up the phone and call the podiatrist. The podiatrist will come into the same room and have a look at that problem. At the same time, the diabetes specialist nurse will come in and observe everything and also interact with the patient on whatever level to get a baseline of where that patient is at.
The two specialists underscore this team approach is critical since most diabetics are often unaware of how to manage their disease, and this leads to bigger problems.
Patients who think they're doing all right, but who really are not aware of what's going on in terms of their own blood sugar levels, who don't really understand the meaning of the numbers, and therefore who have not been able to take sufficient control of themselves.
Most people, diabetic or otherwise, on medication, they don't know why they're on that medication. They don't know the name of the medication. They usually say, well, we take a white tablet or a yellow tablet. They don't know the impact of that medication on them. When they get the side effects of that medication, they may just decide, fine, taking that medication anymore.
Since opening its doors in February, 15 patients have been treated by the center, and according to McConney, the results have been more than satisfactory.
13 of them have reached target of where we would like them to be. And it has been wonderful because it's not just the management is not just that clinical intervention. It is also the education. We have an education support group. And through the support group, those members were able to build new friends. They started exercising. They started dieting. And, you know, as a result of that, lifestyle. They started to have a change of lifestyle. So if we were to fast forward that success, you know, a couple of years down the road, yes, my prediction would be yes, it will have an impact on society.
The center is open to all Barbadians.
We have an arrangement with the government that patients from the polyclinic who are not doing well, and we have established certain criteria to define what is doing well or not doing well, they're referred through a caretaker at the ministry. They're referred to us. And we will see that patient for a period of up to 6 months to make sure that their measurements, their biochemical levels, including sugar, cholesterol, and all of those indices, hemoglobin A1C, are restored as close to normal as possible. We make sure that the patient understands the medication they're taking, the implications, as Simone has explained very nicely. We make sure that the patient is able to take care of themselves. And after that, then refer them back to the government.
Both McConney and Dr. Jordan are anxious for Barbadians to exploit the benefits of the center, but they are especially urging citizens to take steps to avoid getting the disease. Dr. Jordan wants strong action taken to arrest the growing number of children with type 2 diabetes, which is normally seen in the elderly.
A lot of it is preventable. If people understand the causes and the relationships within diabetes, that if you live a relatively healthy lifestyle involved in activity and eating sensibly, then you can prevent a lot of those complications.
At the end of the day, our health is based on the choices that we make, and that's all we can ask. You know, is this a good choice for your health? And whether you have a chronic disease or not, is what you put into your mouth going to be useful for your body or not?